I just want to make sure that they're moving. Yeah, okay.
Yes,
I
they
think
are.
so. All right. Awesome. Well, thank you everyone for being here. And as we're winding down this conference, I just want to say thank you to all the volunteers and organizers and other presenters, as well as all the attendees. So my name is Stefan de Villiers. I am a clinician, a mental health counselor. I work out of Calgary, Alberta, Canada. I also coordinate a program that's pretty unique. It's called the Male Domestic Abuse Outreach Program out of the Calgary Counseling Center. And just to give you a bit of context, so the Calgary Counseling Center is a general mainstream community mental health center. We service all people. And then this program is a bit of a standalone item within that context. And how it came to be that the program ended up with us is that it was actually started out at a women's shelter. So there was a women's shelter about 90 minutes outside of Calgary that recognized that there was a lack of services for male victims. And this was in the early 2000s. And so they spearheaded developing this program, this outreach program. And the problem is that there was a limited amount of funding. Often it does come down to funding. And so they were, in a difficult position, and they were looking at options. And our agency, because we are, fairly neutrally situated, we were seen as a good option to take over the program. We had already been running a group program, a group therapy program called Turn for the Better that was for male victims. So we had done that pilot project at our agency, and we were also providing clinical services to the shelter. So we seemed like a natural fit. So we took it over in 2009, I believe, and we've really been kind of leading it ever since. I'm going to move my slides over. All right, so who are we servicing? The program is open to everyone within the Calgary region and vicinity. Just to give you kind of context, so Calgary has a population of around 1.3 million people. Our borders have kind of spread a little bit with the pandemic. We are now servicing people across the province. And, so online service delivery has actually opened up, a lot more options, particularly for that rural urban divide. We we try to meet men where they're at. We're not telling them what to do. We're just trying to kind of assess what they need and then connect them with proper resources. While I am a mental health clinician, my role at the agency is as an outreach coordinator. So when people come in, it's not necessarily for mental health services. They're also coming to me because they need to be connected to other resources within the community. And so, I've put on this slide the 4 buckets of the types of people that we're getting coming into the program. So, we get men coming in that are saying, you know what, I'm in an unhappy relationship right now. I'm not sure whether this is abuse, but I know something isn't adding up, and I need, I need an outside perspective on what's going on. So that's the one group. Then we have men who are coming in who have experienced abuse, and they're not necessarily looking to leave the relationship, but what they do want is some help. So whether that's couples counseling, or they want counseling for their partner or counseling for themselves, they just want the problem to be solved, and are looking for resources that can help them with that. The third group of men that are coming into the program are men who have, experienced abuse. It's recognized as abuse. Often they're being referred by third parties. So that might be, police or a mobile response team or child services. And they're looking for help to leave the relationship. They're looking for resources, whether that's a shelter or legal support or counseling or all of those things. And then the fourth bucket, which is rare, but it does occasionally happen. We do get men that are accessing our program who feel that they have been victimized, but then as we're doing more of a needs assessment and a risk assessment with them, it becomes, clear that they are the primary aggressor in the relationship. So just to give you some numbers, so these are numbers for how many clients have been accessing the agency as a whole since between the years of 2017 and 2022, July 1st. So we've seen, of all genders, we've seen about 41,421 clients. Of those, we saw 15,137 that were men. So that's about 38% of our overall client load at the agency are men. And then out of those men, we see about 3,414 were fathers. So that's about 8%. And you'll notice that there is quite a skew, right? That most of the clients that are accessing mental health services are female. And I think that our agency is not unique in that context. Our agency actually sees more men than many other agencies that are considered mainstream agencies. So in terms of the reasons why fathers are accessing services, we have noticed certain trends. We collect data from all our clients that come in that give us a bit of a picture. And so what we're seeing is that most men are coming into our services because of one of these five items. So marital relationships are breaking down. They're suffering from depression, they're suffering from anxiety, and often that depression and anxiety is the consequent of a relationship breakdown or problems in the relationship. Spouse abuse is up there as well, and then family relations, often, conflict around kids. So in terms of what the outreach program consists of, it really has three, what I would say, pillars. The first pillar is around just providing information. So the first column there, where people can call into a direct line, they can email our program directly. There's no fee to connect with us. There's no wait list. There's no referral needed. People can just contact us. And in that context, we provide referrals to other services if they need them, and then crisis counseling and a needs assessment to figure out what they need. Prior to the pandemic, we were also meeting with people in the community on their own terms, kind of thing, like at a coffee shop or walking in the park or somewhere public, that just made it a bit more accessible for folks who maybe didn't feel comfortable coming into a counseling agency. That has shifted since the pandemic, and now we are doing outreach by video and phone, which has in some ways opened up more possibilities for people to connect with us. The second column kind of lists the counseling aspect of the program. So we do provide one-on-one counseling. That's mainly what we do. On occasion, we will provide couples counseling, and then there's group counseling as well, both for the men and for their families. So we do have some groups that are for parents and kids, which is not part of the outreach program, but is part of our agency that families can access as well. For all our services, we really work hard to not have a wait list. For the counseling part, there is a sliding scale, which is based on a self-reported household income. There's no limit on the number of sessions that people can access, and there's no referral needed. Yeah, and then the third column of services that we try to provide through the program is that we do community engagement events, lunch and learns, mainly for other service providers within the domestic violence field or sector. Also working with child services and with the mobile response team and distress center and so on. We also have partnered on a number of research projects through the University of Calgary. We did one with Resolve, which is a group of researchers that research domestic violence across the Prairie provinces. We were part of that, and we always are looking for researchers who want to use our data to provide a better picture of what men are going through. And then we offer conference presentations like this one as well. So in terms of men's experiences of abuse, there are some differences that we're noticing where men are reporting a different experience than women are. I mean, there's emotional abuse, definitely. There's physical abuse. What we do see a lot more is men reporting, false allegation, threats that are being made, being alienated from their children, legal administrative abuse, financial abuse. Also, we're seeing among men that they have often more sort of physical illnesses as well, chronic health issues that are coming up. Um, and then, sexual abuse, I would say, is lower among the males that are accessing my program versus the females that are accessing our agency. Um, in terms of gender norms and gender socialization, this is an interesting area, I think. What we're noticing is that often those gender stereotypes and gender norms are impacting how men are experiencing the domestic violence, but it also is impacting how they're responding to experiencing abuse, right? So often when they're in a relationship where there is domestic abuse, their partner might be using those stereotypes to control or humiliate them, right? So, you know, things like telling a male that they don't have emotional needs, or they don't have a right to emotional needs, or that their role in the family is to be the provider and that's all, or that they that they're weak if they get upset, or if they cry. So those things are often used by the perpetrator against the man. In terms of how men are responding to domestic abuse, I'm finding that a lot of times they are not reaching out to service providers like me until it's fairly severe, right? So until perhaps there's legal involvement, or child services is involved, or there's family breakdown. It seems to be that men wait longer before they're looking for support. Men are also reporting social isolation, where they feel like they can't speak about their experiences. I think we've heard a lot of that throughout the conference, where men are feeling that there are not a lot of services available to them. And where men have reached out for supports, what I'm hearing from clients is that they're getting kind of inconsistent messages. So in some cases, they'll go to the police and they'll get a positive response, but in other cases, they might go to the police and be laughed at, or be told that they're lying, or not be believed, or be arrested, even though it's clear that they have been victimized. In terms of the supports, also there is, often they're being referred to programs that are for perpetrators, even when there are victims, they are victims, and that might be because there are no programs available, and that's just where people get sent, males get sent, and so that is also a barrier. Our agency collects quite a bit of data, and this helps us, I think, in terms of our advocacy, and also in terms of funding, because we can actually show from the data that we're collecting that the interventions that we're providing are actually helpful and useful. And so we use what's called the OQ 45.2 measure, which has some subscales that measures people's level of distress, their interpersonal relationships, how they're getting along with their loved ones, and then how they're functioning at work. And also there are some critical items that we track. So suicidality, substance use, work violence, or aggression. We know that all of these scales tend to be higher among men who are accessing counseling services for domestic violence. I'm not going to read everything on this slide, but I'll just point out that the average client that is accessing our programs are benefiting in a statistically significant way from the programs that we're offering, and that 56% of the clients are improving or recovered by the end of the treatment from our agency. So I'm going to end with just some testimonials from people who have gone through the program. I think these sort of demonstrate the value of providing mental health services that are targeted towards men. One individual indicated that my online sessions were an opportunity to connect with like-minded, similarly situated men, find some camaraderie and support when I was going through a hard time. Another individual said that the program turned my life around, helped me find the strength I needed to make the decisions that I needed to make to improve my life. And then finally, the online version of the sessions did help to accommodate my travel and scheduling difficulties that I was facing with in-person sessions. And there we see that, going online has definitely had some limitations also around safety, and also, where there's a digital divide where not everybody has access to the internet or smartphones or computers. But in other cases, it has definitely help people access services where otherwise they may not have been able to. All right, I'm gonna end there, and I think we're at the Q&A portion of the event.